All right. Welcome, everybody. My name is Jessica Chu, and I'm the Research Ethics Facilitator for the Clinical Trials British Columbia, and I'm really pleased to welcome you for this session. So before we begin, just a little bit about format. Each presentation is going to be 30 minutes long and 15 minutes for presentations, and then followed by 15 minutes for Q&A. So as a facilitator, I will be monitoring the time closely, so if there's any additional questions in the end, we have time for that. And just to ensure that the second presentation starts on time. So thank you in advance to everybody for supporting that. So our first team presenting is going to be a unique model for institutional change titled Catalyzing Learning Health Systems at the Comox Valley Hospital. And it's to lead us through this community-engaged approach. We are joined by two key members of the Walk With Me project, Dr. Sharon Karsten, a Michael Smith Health Research BC scholar and faculty member at Vancouver Island University. She is a PhD with SFU, and Sharon is a community development researcher and initiator of the Walk With Me, a project that uses arts-based research and story walking to uncover the human dimensions of the toxic drug crisis. Christopher Hauschildt, the operations coordinator and a peer researcher with Walk With Me, is a graduate student in global leadership at Royal Roads University. Christopher brings the lens of lived experience to his work, focusing on co-creating equitable health systems and expanding peer leadership opportunities within social institutions. So please join me in welcoming Sharon and Christopher.
Hello. Thank you for the introduction. Everyone can hear us okay? Right on. I'll just start off, if I could, by acknowledging the territory we're coming in from today. So both of us are calling in today from Comox unceded traditional territory. We also work often in Snuneymuxw territory, Likwita territory, Tla'amin territory, and we're just so grateful for the teachings we've received from elders and knowledge keepers from these lands. And what an honor it's been to hold stories and communities in the midst of this crisis throughout these lands. So my hands are up for those teachings. Would you like to introduce yourself? I know we were introduced, but anything else you'd like to say?
Yeah, just to say that, I am one of several different people with lived and living experience who are part of this multidisciplinary community engaged research project who are not with us today, but always really important to mention the many diverse perspectives that inform this work as we are a multidisciplinary team. And with that, I'll kind of pass it back to Sharon there.
So maybe what we can talk a little bit about as you can tell, we operate in somewhat informal ways and have been honored to do this work across many communities and to receive wisdom from many folks who are experiencing the toxic drug crisis firsthand. I think maybe what we'll start with is a little bit of a history about Walk With Me, where we come from, how we came to exist, and how we continue to do our work in communities, some of the core principles, and then move into talking about our work right now at the Comox Valley Hospital. So maybe I'll just start by saying we started back in 2019, Walk With Me did. At the time, I was the director of the Comox Valley Art Gallery, so a public arts institution, downtown Courtenay, that was really reeling from the impacts of the toxic drug crisis. So we were witnessing the impacts of this crisis on youth in our community, artists with whom we worked, people living just outside the art gallery, and wanted to know what an art gallery could do to make change. And so through that question, we went to our now longtime partners, ABI Health and Community Services. We went to medical health officer for our region within Island Health and asked how arts could play a role in crafting the conditions for change. And so through those questions, the project was born. The project really involves sitting in circle with people with lived and living experience of the crisis, family members, people who are in service roles in various components of the system, and asking about the impacts of the crisis, but even more importantly, I think, about pathways forward and about folks' imagination for a different world, a different future, a future where people are supported amidst this crisis. And so we started this work in the Comox Valley in 2019. We were honored to connect with AVI Health and Community Services Group that really fed into the design of the project in its early days. And then COVID hit. And so where we had been sitting in circle and collecting, we were gifted powerful stories about the crisis and its impact. We weren't able to share them as we had been kind of mandated to do by those who gave their voices. And so we started reaching out through a silent disco headset system. So we have a format called Story Walks, which involves taking people, groups of say 20 folks at a time out and wandering through the neighborhoods and listening to stories of this crisis and its impact and visions for the future. And so that format, Story Walks, which after we come back from our walk, we sit in circle. We've been taught to hold space in circle. And that format has become very powerful. It's kind of like the center, if you think of a wheel, it's the center of the wheel. And then there are various spokes that come out of the story walks. So research is one spoke, and consultation and dialogue and visioning and community imagination and prototyping. And all of these pieces kind of come from that act of sitting in circle. Maybe I'll pass it to you.
Thank you, Sharon. Yeah, and I think it's really important to preface with this platform of story walks that we've kind of been honored to co-create, because it serves as a basis for gathering, for foregrounding voices of lived and living experience in circles where they might not otherwise be heard, especially when considering policy or strategic development. And there are, it's worth mentioning, many branches of this project. We've been honored to receive invitations from all across this province to go and share this practice. Sitting now across some 400 story walk sessions with about 9,000 people over the last 6 years. But the main focus of this work is regarding our work within Island Health and sort of that story of how it's unfolded. So it was about 2020, 2021, we were invited to work within Island Health in Campbell River, Oceanside Health Clinic, and the Comox Valley Hospital, really sitting with acute care staff, again, delivering these story walks in a research capacity. So when we talked about returning from circle and holding dialogue to respond to the stories, we were also asking research questions of how can the institution better support people at the heart of this crisis, and what is working well. And what started in a sort of small way in these 3 sites expanded into a service delivery contract, seeing us across 2023 to 2025, engaging in Island Health sites all across the island. We received a service delivery contract to deliver 57 of these story walks to any site requesting it. And so here's an example of a couple publications that came from some of that work. There is a peer-reviewed journal article we participated in regarding learning health systems that's not mentioned here, but worth mentioning again to kind of convey a bit of the story of where we're at now. So from all of this, we ended up being honored to sit in a more involved way in the Comox Valley Hospital through 2023, 2024, engaging with management at all different levels in all different departments of the hospital and asking what challenges were being experienced and what was working well. And from these engagements where we shared stories, we heard a few key findings, few key needs. One was the need to strengthen peer leadership, reduce and eliminate stigma, close gaps in the continuum of care, not just in the hospital, but in connection to community, and strengthen humanizing and welcoming practices for peers. And since this time, we've been invited to work out of what's called the North Island Research and Innovation Hub at the Comox Valley Hospital here on the 4th floor, which is where we're calling in from today. And in response to all that we've heard and being embedded in here, we've kind of begun work on what we're calling the Comox Valley Harm Reduction Intensive, which is really an act, as I see, of catalyzing the learning health system at the Comox Valley Hospital. And I'll pass it back to Sharon to speak a little bit more to some of what the intensive involves.
Yeah, I just want to note first that it's always a bit of a shocker when like the bright pink comes up, because our colors shifted so radically between the previous reports and what this initiative means and is. And I think part of that work of like almost color coding is about reaching out in a way that is very accessible, that is warm, that invites people to the table, and that makes harm reduction something that's not scary. And so being able to kind of like shift even our sort of like our publication formats and make things really accessible is a key part of our work. So here at the hospital, we've been working over, so we actually, I'll reverse and go back by about a year when we started meeting with the site leads here at the Comox Valley Hospital, who invited here in the Research and Innovation Hub, and asking how we could be a benefit to the hospital, how we can, do this work in a good way. And so from those conversations, we started a kind of advisory team. We developed this concept around a 6-month harm reduction intensive that would involve a bunch of training, learnings, both from Island Health, drawing on its pre-existing and in some cases evolving learnings that it has either online, but also in person through various people within the institution who are mandated to do this work. And also our own connections, having been across multiple Island Health sites and also in multiple communities. So we kind of, through all of that earlier work that we talked about, and I don't think we really mentioned some of the communities we've been in, but Campbell River, Cathet Powell River, all the way down island to Victoria, and over into the mainland as well. But we were drawing on some of those resources, some of the key leaders that we encountered in these communities who were doing this work in powerful ways, and brought them in as part of this, wove them into the harm reduction intensive. So this intensive involves a few key pieces. One is this slate of learnings, workshops and presentations. Another is a series of story walks. And so the story walks are hosted by Walk With Me and really serve as a platform. As we had mentioned, we kind of finish our story walks in circle, and that circle provides an opportunity to vision and plan for the future. So we ask in that circle how this site can better support folks at the heart of the toxic drug crisis and what it's doing well. And then those pieces get woven into a report, which will come out in probably June of this year, a What We Heard report that summarizes all of the conversations we've had over the last 6 months. And then there's a research component involving surveys where both staff at the hospital and people with lived and living experience who have just been to the hospital are asked to give their input on how that was, how the site is serving or needs improvement in terms of its services. So all of those pieces are kind of woven together in the 6-month intensive. And one of the pieces as well that I haven't mentioned yet is kind of a legacy piece around continuing this work after the intensive, where we have an advocate circle. We now have, a list of 60 folks in the hospital who have said, like, yes, count me in. I really want to be part of this. And with the advocate circle, we are kind of embedding these principles around harm reduction and the notion of systems change and the possibility of systems change into this group so they can continue on the work afterwards and help kind of mobilize the insights that we gained.
Yeah, to just speak briefly about some of what the workshops that we're offering look like, they've been structured in a way that responds to some of the needs that we heard were identified. So, for example, the need to improve dosing guidelines. We've worked through our connections to bring up ICU and ED doctors from Royal Jubilee Hospital who have a ton of experience in this realm to share some of their learnings with other doctors. And then the comment around embedding peer leadership within the hospital, we brought down a peer support worker from Campbell River who's working in that hospital to speak about their experiences. We've co-developed with the branch of harm reduction workers in Island Health a workshop surrounding best practices and considerations for hiring peers. And we were bringing this workshop up as well. And so many of the interventions that we've conceived to date are trying to respond to needs we've heard identified. And also within these, there's this cycle of opportunity for generative feedback for people to feed into and inform what else needs addressing or what else is working well. And it's worth mentioning as well that at every step of the way, there are people with lived and living experience sort of facilitating, holding the space, and informing this work of considerations around substance use related care from the lens of people with lived and living experience. I think we're running pretty close to time here.
Yeah, I think if I could just maybe close off by saying we found, I think, unexpectedly quite a power in getting in mobilizing a whole site around this. We've had incredible participation from multiple layers of the site, including, clinical nurse educators to the site leads, and all of that matters when you're trying to create systems change and chart a course that's different than the one, or slightly different or augmented than the one that a site is currently engaged in. And so, it's a humbling experience to work within this site and to see the actual potential for change as we do this work. And I'll end it there and pass it back to you, Jessica.
Thank you both so much. That was wonderful. Are there any questions for Christopher or Sharon? Nothing right now. I'll jump in. Could you speak a bit more about the advocate group? Yeah.
For sure. Oh yeah.
Oh, Shay.
And Shay as well.
Go ahead.
I will speak to it, but I'll ask Shay as well if maybe you can do a 2 question.
Yeah.
Me first?
Yep. Go ahead, Shay.
Okay. So I live in assisted living, and I am also I always look through the lens of assisted living or long-term care. Now, long-term care have more and greater concerns in terms of overdosing, not overdosing as in people dying, but giving too much medication for the elderly in order to keep them compliant or to stop them from yelling too much, or whatever the reason is. In assisted living, it is my responsibility most, and my daughter's, in collaboration with my doctor, in terms of medication, and hopefully I have a responsible doctor. Now, I have a nurse practitioner who I thank the universe for every single day. And I find that doctors these days are so fearful that they tend to underdose, because like this is for, patients first, that what's happening in assisted living and long-term care, it is not about the resident. It is about what the doctor feels is they're not afraid to give, or what they want in terms of a quiet existence in the care community. So in my case, no doctor, I had chronic pain, and no doctor was willing to up my dose of a certain medication because they were afraid. They were afraid of how it would look on them. Until I got to my nurse practitioner. So I suffered for that. I got to my nurse practitioner, and he said, well, I guess the only thing left, because we tried everything, and I was suffering. My whole life was changing because of this pain. He said, the only thing we have left to do is to up this. And I said, I thought we couldn't. And he said, oh yeah, you can. So thank you. Let's do it. And my life has changed because of that. Because this person was brave enough and open enough to look at me and say, well, we got to look at your quality of life. And he looked at me and cared enough about me to offer to change this medication. And then on the other side is the long-term care, which is instead of looking at the resident, they are over medicating the resident so that the benefit is for them, the staff, as opposed to the benefit for the resident.
Mm-hmm.
So that's a long way of saying what I wanted to say, but that's it.
Mm-hmm. Thank you.
I don't know if you had any views on that in terms of medication.
Well, let me preface by saying I'm not a medical doctor, but I think that your story is incredibly important. And I want to thank you for taking a moment to share it with us, because I think it illuminates a struggle that is felt in many other areas around patient advocacy and perhaps the needs of the individual not always being heard or not always aligning with a medical doctor's perhaps training of dosing guidelines. And so, this question of how the needs of individuals can be more heard by systems, I think is an important consideration. I don't have any answers for it, but I think you touch on something really important. So thank you, Shay.
Mm-hmm. Thank you. And maybe I'll jump. I know we're kind of jumping between, but maybe I'll jump in and talk a little bit more about the advocate circle, Jessica, just as we kind of had a 2-question thing come up. So I think what I would just say is that the Advocate Circle is a group that meets monthly. It includes anyone who wants to be part of kind of like a movement at the hospital to embed harm reduction principles into multiple different departments and multiple different practices. And that group meets and we talk about some of the challenges that folks are facing on the day-to-day working with harm reduction principles in the hospital, about kind of success stories, things that have really worked well. And it's really a chance for folks to meet each other, to see each other at the site. If you don't have that spot of connecting, you don't necessarily know that people are values aligned around you. And so that group is then playing a major role in both kind of promoting or engaging the wider staff team here at the hospital in the harm reduction intensive, encouraging folks to come out to it, to participate. But also we see them as holding the flame of this initiative as it goes forward beyond that 6-month period.
Yeah, and if I could just build off of that super quickly, Sharon, one piece we didn't touch on in the presentation was trying to address the challenge of creating additional symbolism that would promote to individuals entering the hospital that this is a safe and inclusive place for people with lived experience. And, all of our advocates are given these sort of harm reduction saves lives branded shirts so that they're able to go, and it becomes a talking point of, well, what's that about? What are the principles? What's this initiative about? And it helps catalyze the conversation around substance use within the hospital and within different, perhaps less considered domains of the hospital. Yeah.
Thank you both so much. That's wonderful. I'm actually from the Comox Valley, and I've done a lot of work in the Vancouver downtown east side. And so this presentation hits home, and the work you're doing is just absolutely wonderful. Yeah.
Thank you.
Are there any other questions for Sharon and Christopher? Okay. If anything does come up, please feel free to share it in the chat, or we can come back to it after as well.